Welcome to the Explainer. Today, we're going to master thyroid gland anatomy together. And hey, if you've ever felt totally overwhelmed by complex medical jargon, you are in the exact right place. We're going to take a visually stunning, macro to micro guided tour of the neck to really understand this vital organ. We'll explore the endocrine system, map out the neck anatomy, and make the whole shebang incredibly simple.
But first, I want you to consider this for a second. How does a tiny organ in your neck, we're talking something that usually weighs just 20 grams, manage to control your entire body's metabolism? It's crazy, right? Think of it as your body's ultimate metabolic factory. This little powerhouse produces hormones that literally dictate how your body uses energy, grows, and develops. Today, we're uncovering the structural secrets that let it pull that off. Let's dive in.
Okay, so let's start with the big picture. You can see how the thyroid gland is this beautiful butterfly-shaped endocrine organ, right? It sits perfectly in the midline of your anterior neck, it's tucked right below the cricoid cartilage of the larynx, and elegantly wraps around your trachea, or, your windpipe. Typically, it extends from the 5th cervical vertebra down to the 1st thoracic vertebra, making it actually the largest endocrine gland in the human body. Oh, and here's a quick fun fact. In women, this gland can actually increase in size and weight during pregnancy and menstruation. It's completely surrounded by this deep cervical fascia, which actually helps elevate the gland whenever you swallow.
Now, if we zoom in and really look at the specific parts making up that butterfly shape, we see the thyroid is mainly built from 2 lateral lobes. These are the parts that give the gland its volume. And connecting them right smack in the middle is a narrow band of tissue called the isthmus. This isthmus bridges the gap perfectly across the 2nd and 3rd tracheal rings. If you look closely at those lateral lobes, you'll notice they've got this almost pear-like shape to them. They're much narrower at the top, which is the superior pole, and quite a bit wider down at the bottom at the inferior pole.
Now, here's where it gets really interesting. The thyroid gland actually has a pretty wide variety of anatomical variations. Normally, you'd expect a standard H shape or U shape. But wait, look at that finger-like projection pointing straight up from the isthmus toward the hyoid bone. That right there is called the pyramidal lobe. And get this, up to 50% of people actually have this extra 3rd lobe. It's a vestigial structure, basically a leftover remnant from our embryonic development called the thyroglossal duct. It really just goes to show that human anatomy is absolutely never a one-size-fits-all situation.
Moving on, let's break down the actual borders and surfaces of the thyroid. Each lobe is meticulously structured. The lateral surface, that large outward-facing area, is also known as the superficial surface. Inside your body, this surface is securely covered by the infrahyoid muscles in your neck, acting kind of like a protective shield. Then there's a medial deep surface that hugs incredibly tightly against the larynx and trachea, along with a posterior border where a really important surgical landmark called the zuccocondyle tubercle often extends out.
Okay, before we flip around to the back of the thyroid, we really need to talk about its hidden neighbors. Enter the parathyroid glands. If the thyroid is your metabolic factory, well, the parathyroids are the body's calcium thermostats. They are entirely separate endocrine glands with a totally different job. They produce parathyroid hormone, or PTH, to strictly regulate the calcium levels floating around in your blood. So, whenever your blood calcium drops, these little thermostats sense it immediately. They release PTH to pull calcium out from your bones and boost absorption in your intestines and kidneys.
Looking at the posterior or backside of the thyroid, we finally see their hidden location. See those small pea-sized structures sitting quietly right there on the posterolateral surface? Those are the parathyroid glands. Typically, a person has 4 of them, 2 superior and 2 inferior glands. But honestly, that number can range anywhere from 2 all the way up to 6. They're incredibly tiny, weighing literally just a fraction of a gram, and are packed with specific cells called chief cells and oxyphil cells. Plus, they usually have this distinct yellow-brown color, which is super helpful for surgeons trying to distinguish them from regular thyroid tissue.
To truly master neck anatomy, you have to understand the real estate here. Who are the neighbors? Looking at this anterior view, you can see just how crowded the neck really is. Anterolaterally, the gland is shielded by those strap-like infrahyoid muscles we talked about earlier. But look just behind and to the side of the gland, posterolaterally. That's where the vital carotid sheath lives. Think of this sheath as a heavy-duty protective tube. It houses the massive common carotid artery, the internal jugular vein, and the absolutely crucial vagus nerve. And the thyroid? It's sitting right in the middle of all this critical infrastructure.
Because the thyroid is such a crazy, busy metabolic factory, it demands a massive amount of resources. This part is actually often misunderstood, so let's think about it like a highway network.
The arterial blood supply to the thyroid is extraordinarily rich, forming this incredibly complex vascular network that totally surrounds the gland. It's essentially fed by two major pairs of highways. You've got the superior thyroid artery coming in from the top and the inferior thyroid artery coming up from the bottom.
So, the key takeaway here is understanding exactly how these two arteries divide up the workload. The superior thyroid artery originates high up from the external carotid artery, and it basically takes care of the entire upper portion of the gland. Meanwhile, the inferior thyroid artery, which by the way is actually considered the principal supplier of the thyroid, originates from the thyrocervical trunk lower down. It perfuses the inferior and posterior parts. And what's really cool is that both sets of arteries actually anastomose. That means they connect with their counterparts on the opposite side to guarantee a constant, totally fail-safe blood supply.
Now, remember earlier when we talked about anatomical variations? Well, about 10% of the population has another fun anatomical quirk called the thyroid artery. Instead of coming from the usual sources we just covered, this super rare variant artery branches straight off the aortic arch, or sometimes the brachiocephalic trunk, deep in the chest. It then travels straight up the windpipe to feed the isthmus and the lower aspects of the gland. Pretty neat, right?
Of course, all that blood coming in eventually has to flow back out. The venous drainage system of the thyroid operates through three main paired veins that pop right out from a network on the gland's surface. The superior thyroid vein and the middle thyroid vein both drain laterally, dumping directly into the massive internal jugular vein. But the inferior thyroid veins, they take a totally different route. They flow straight down into the left and right brachiocephalic veins. It is just a highly efficient, multi-tiered drainage system.
All right, let's move to our final major anatomical feature, and this one carries absolutely massive clinical relevance: the nerve connections. So the thyroid gets its autonomic innervation from the vagus nerve and cervical ganglia. Interestingly, those actually control the blood vessels rather than the hormone production itself. But look really closely at the recurrent laryngeal nerve passing right behind the thyroid. This nerve innervates your voice box, and it passes dangerously close to the inferior thyroid artery. If a surgeon accidentally damages this nerve during a thyroid or parathyroid procedure, it can cause severe hoarseness or even total loss of voice. It's a hugely critical relationship every surgeon has to keep in mind.
Okay, let's do a super quick recap of what we just explored. Number 1, the thyroid is your butterfly-shaped metabolic factory, generally made up of two lateral lobes and a central isthmus, with some folks having that bonus pyramidal lobe. 2, hiding on the back are the tiny parathyroid glands acting as your body's calcium thermostats. 3, the whole gland is fed by a remarkably rich arterial highway network. And finally, knowing its anatomical neighbors is critical, especially the recurrent laryngeal nerve, which must be protected at all costs to save the voice.
And just like that, our macro to micro tour comes to an end. So I'm really curious, what's one surprising fact you learned about the thyroid today? Was it that crazy extrapyramidal lobe? Or maybe the hidden parathyroid thermostats? Let us know down in the comments below. We absolutely love making the complex simple for you guys. So if you enjoyed this efficient, visual approach to anatomy, please make sure to hit that subscribe button for more simple medical explanations. Keep learning, and I'll catch you in the next explainer.